Hey guys, Dr. Chad. We're still looking at some anterior shoulder pain, or pain that's kind of right in the front of the shoulder. And sometimes that can actually come from the biceps. So maybe you find yourself in a position where you're doing lots of work with the elbow, lots of elbow bending, maybe with some tools or something like that. Whatever the case may be, we want to be sure and target this to minimize pain in the front of the shoulder. It's easy to do, it requires no tools, which means you can do it anywhere at any time. The bicep actually lays kind of on top of the big flexors in the arm, and so we want to be sure and target that. So if you kind of pinch from the sides, that's going to get all of your bicep between your fingers, and then you're just going to do some elbow flexion extension or bending and straightening, and ideally we're looking to reproduce that pain. And if you want to get a little more specific, you can take your fingers and press down in. We can still follow that seek and find method here, where we're going back and forth, finding tender stuff, tracing the bicep all the way up to the shoulder, and you can do it on the medial side or towards the inside, and you can do it towards the outside. So here's the outer bicep, here's the inner bicep. And once you find one of those spots that's tender, now we know where we can do some work. We're going to go back to that same pin and stretch, kind of flossing the muscle underneath the pressure. And ideally, if we can reproduce some of your symptoms, that means we're working in an area that's going to help minimize those symptoms. We'll see you later.